The nature of the injury is a sprain occurring in the ankle. An ankle sprain is a common injury which occurs when there is an overstretch of supporting ligaments around the ankle, causing ligament tears and possible bleeding at the joint, and is often caused by rolling of the ankle. A soft tissue injury through direct or indirect force. Ankle sprains range from grade 1 to grade 3 depending on the severity of the sprain. An ankle sprain is a very common injury suffered in many sports. In the case of the footage, the players suffer from an indirect injury because there is no physical contact from an object or person. Management. To manage a sprained ankle, the athlete should apply the Ricer method to the injury. Rest. The injured area must remain as inactive as possible for the first 2 to 3 days. This time is dependent on the severity of the injury. Ice. Applying ice allows the blood vessels to constrict, thus reducing inflammation at the site. Ice should also be applied to surrounding areas as well as the direct site. Ice should be applied in a wet towel for 20 to 30 minute interval for the first 2 to 3 days. Compression. Using a wide elastic bandage over the injured and surrounded areas in order to reduce swelling and the build-up of fluid. Elevation. The injured area must be raised above the level of the heart to limit inflammation. Referral. Medical assessment should then be undertaken as soon as possible to understand the full extent of the injury. Talk. Ask the athlete questions, gathering information on the cause, nature, and site of the injury. Example, where does it hurt? Observe. Search for deformity, swelling, and redness, compared to the opposite limb. Touch. Gently touch the site without moving it, observing the level of distress the athlete has while touching the area. A. Active movement. Get the athlete to maneuver the area around on their own and look for the signs of distress. Passive movement. Requires the first aider to take the injured area and determine the amount of pain-free movement that is possible. Skills test. The athlete should perform skills that would be used within the game, through training drills such as dribbling a soccer ball through the cone. Progressive mobilization. A gradual transitioning phase concerned with extending the movement of the injured area back to full mobility whilst remaining in a pain-free range of movement. Graduated exercise incorporates 3 key parts: stretching, conditioning, and total body fitness. Stretching. Due to the loss of flexibility as a result of injury, stretching is imperative to obtain the performance levels previous to the injury. If completed correctly, stretching will enhance the rehabilitation procedure by reducing muscle tension, increasing circulation, increase muscle tension and tendon length, increasing the range of motion. This is done through proprioceptive neuromuscular stretching and slow static stretching, increasing the time of stretching from 5 to 10 seconds to 20 to 30 seconds in order to increase the motion of the injured area.
Take your foot, and what you're going to do is move your entire foot in the ABCs. So first we'll just do an A. Great. And then go through the B. C. And you can go the whole way through the alphabet. You can keep
Conditioning. Restoring muscle strength is essential in rehabilitation. Muscle atrophy should be prevented through isometric exercise programs, although immobilization is in process. These exercises involve no movement in joints, but develop strength in the area. Progressively adding resistance and weight-bearing exercises can be added as pain is reduced and mobilization increases. Total body fitness. This refers to the process of maintaining overall body fitness, however this is difficult with an injury to the ankle. Training. Once rehabilitation has finished, an athlete is not ready to return to play, with significant risk of re-injury due to movement skills, in-game skills, and confidence not being re-established due to rest from competition. Training is aimed at returning the athlete's skill level to pre-injury levels. Only when the athlete is displaying full fitness, coordinated movement, and skills at full capability, then the athlete is ready to return to play. Use of hot and cold. Only cryotherapy should be used to acute injuries such as ankle sprains. This can be used in numerous ways, for example ice bags, ice baths, contrast baths, or ice packs, and should be used after therapeutic exercise of the injured site, reducing pain and swelling as well as cooling overheated participants.
Pop it in the centre of the wraparound compressor bit. Now it has a strap at the side, you fold that up, you won't need that. Place it over the sore component of your ankle, on the outside, wrap it around firmly. Okay, and then you can leave.
Pain-free movement and degree of mobility. Being pain-free and having full mobility in the injured area are key indicators of readiness to return to play. By using basic fitness tests such as the Pdhpe or Illinois test or skill tests such as dribbling through cones, you can tell a coach whether an athlete is back to full capabilities. An athlete should also be put through sport-specific fitness tests, for example in soccer dribbling the soccer ball, then sprinting 30 meters, then repeating this process. Specific warm-up procedures. Longer, harder, or more specific warm-up and stretch routines allow athletes who have been injured extra time to properly warm up the injured site. After coming back from an ankle injury, it is important for the athlete to spend longer stretching the muscle supporting their ankle in order to prevent re-injury. It also gives the athlete mental benefit before going into competition. Pre-test, post-test. It is important to compare the results of pre-injury tests and the current state tests, as well as giving feedback to the athlete while monitoring the injury. The athlete should follow the advice of coaching and professional staff in order to get back to pre-injury levels. Therapy should be ongoing until these levels are reached. For example, cryotherapy after workout for the sprained ankle would help recovery for the athlete. Psychological readiness. It is just as important for an athlete to be mentally ready as it is for them to be physically ready to return to play. Anxiety before returning to competition after a serious injury, for example a grade 3 ankle sprain, is common, and it is important to hold discussions with the player to see where they are at on a psychological level about returning to play. Policies and procedures. Coaches, sports administrators, and sports medicine practitioners are all factors in establishing guidelines on returning to play and whether the player who has sustained the injury should be allowed to return to competition. Priority at all times must be given to the player welfare with advice from medical staff. Pressure to participate. An athlete may feel they are being pressured into returning to competition before they are ready, either by their own internal pressure or external pressure from coaches or fans. For example, the soccer player who sprained their ankle thinks that they are going to lose their place in the team is internal. However, if they are under financial pressure, this is an external pressure put on the player to return to competition. By returning too early, a player is putting themselves at higher risk of re-establishing or further injuring the injured area. Use of drugs. The pressure on players to participate is a large factor in the large number of cases where painkillers are being used to take pain away, with financial as well as other factors increasing, and advances in drug technology. The use of these drugs are an increasingly troubling issue.